All right, everybody. Hello and welcome to the July edition of the DuPage ROSC presentation series. My name is Jared Burton. I am your DuPage ROSC coordinator. Glad you could all be with us here this morning. If you're unaware of what the DuPage ROSC presentation series is, we started it a couple years ago as a monthly presentation to kind of do some presentations on the continuum, some things that are maybe a little outside the box, some things that are kind of on cutting edge as far as like substances, treatments, therapeutics. Kind of take a full hour to dig into a topic that has a lot of information. And that's where we were finding at our previous ROS Council meetings, we weren't able to really dig into a topic for more than like 15 minutes at a time. So it's cool to be able to take the time to do this. I am very proud to introduce our presenter for today. I'm going to do the quick introduction here, but Annette Villareal came on board last year as the ROSC project coordinator. She came to us through Recovery Corps, which is a arm of the AmeriCorps Jobs program, and she has been fantastic. She has been able to provide us with some outreach and some help in some areas that were definite blind spots to us. And when we were talking about having her do a presentation, I asked her, like, what are you passionate about? Is there a topic, on the recovery continuum, substance use, mental health, that you're passionate about? And she had brought up this topic of motherhood and substance use. I have to admit 100%, this is a huge blind spot for me personally. There's a lot of different areas on the continuum. I feel like I know a little bit enough about to be able to kind of work with it, but this is definitely an area where I just was, listen, you teach me. I know nothing about this type of area. Annette has a great background on this, and she can probably talk a little bit about that at the beginning here. But we're glad to have her here with us, and we're really glad to have her kind of walk us through everything from prenatal to pregnancy to postpartum, and she has a really great presentation for us today. So everyone give a virtual round of applause to Annette Villareal. So we're in the same room, so we may do this little game of mute tag. So I'm going to mute myself now, and Annette, I'm going to turn it over to you.
Thank you, everyone. And again, thank you for joining us today. I have had previous experiences working, in the early childhood field, but also in emergency shelters with young ladies and teen parenting programs. I have been in the field for over 20 years. And again, like Jared had mentioned, when he asked what one of my passions was, I did explain to him that because I have worked very closely with this community in early childhood and parents, postpartum and pregnancy was one of my big passions and missions in life. So this is why I decided to present on motherhood and substance use and some of the complexities in recovery, because it seems to me when I am doing outreach and when we are having presentations, we speak a lot about recovery in different forms and pathways, but little to me is heard or informed on pregnancy and postpartum during substance use. So thank you again for joining us, and let's begin. Again, thank you for joining me today. I chose to discuss motherhood and substance use and their complexities of recovery because supporting pregnant people who use drugs in their recovery is both a personal mission and my lived experience. Having faced postpartum challenges and substance use, I clearly see the urgent need for compassionate, informed support for pregnant people. This presentation will focus on the intersections of motherhood, substance use, exploring the challenges pregnant people face to support their and supporting their recovery. Please note that during the presentation, you will hear me interchange the words women and sorry, give me a second here. women and mothers to pregnant people at times. This topic isn't just research, it's reality. It's about breaking stigma, amplifying trauma-informed care, and building systems of support that honor dignity and resilience. By sharing this perspective, I aim to promote awareness, compassion, and action among healthcare providers, policymakers, and community advocates. Recovery is possible, and when supported with inclusive, evidence-based approaches, it can become a transformative pathway, not only for individuals, but for the entire families and communities. Now is the time for each of us to listen and take tangible steps, whether by advocating for policy change, integrating trauma-informed practices, or supporting community networks to ensure every pregnant person can recover and thrive. So in today's agenda, we will begin by understanding substance use during motherhood, by looking at the prevalence, common substance use, and the underlying risk factors. Next, we will discuss the challenges pregnant people face. Including impacts, health, and societal stigma. We will then explore recovery both during pregnancy and postpartum, discuss harm reduction strategies for pregnant people who use drugs, concluding with early intervention practices for healthy child development. Substance use during motherhood poses significant challenges and risk. Understanding the prevalence and types of substance use is critical for effective intervention and support for pregnant people who use drugs. Substance use disorders among pregnant people intersect with trauma, stigma, and systemic barriers. Past traumatic experiences can increase vulnerabilities to substance use as coping mechanisms, and stigma around substance use during pregnancy often is framed more as a moral failing rather than a health condition. Systemic barriers like lack of responsive substance use treatment, racial bias in healthcare, and punitive policies. SAMHSA 2023 stated, only 1 in 8 pregnant women with substance use disorders receive treatment. Research shows that substance use among pregnant women is a growing concern. Statistics indicate that a notable percentage of mothers use alcohol, tobacco, or illicit drugs, highlighting the needed support and awareness. The CDC 2023 reported 8.5% of pregnant women use illicit substances. Alcohol and tobacco are the most common. Some drivers that might lead to substance use during postpartum and pregnancy can be trauma, mental health disorders, and socioeconomic stress. I would like to highlight that 50% of pregnant people with mental health disorders suffer from co-occurring depression. The impact on the unborn child may lead to fetal alcohol spectrum disorders, neonatal abstinence syndrome, and preterm birth. The need for support is urgent. According to the Policy Center for Maternal Mental Health, an estimated 62 million birthing age American women, or 96% of the potential perinatal population, live in maternal mental health professional shortage areas. 13,885 providers are needed across the United States to fill these gaps. Common substance use by pregnant people include alcohol, nicotine, and opiates. Each of these substances poses unique risk to maternal and fetal health, making it essential for healthcare providers to address these issues proactively. There is no known safe amount of alcohol to consume during pregnancy. Even light or moderate drinking can negatively impact a fetus. Smoking can lead to premature birth and birth defects. Opioid use disorder during pregnancy can result in preterm labor, fetal convulsions, and fetal demise. In a relatable scenario, we'll talk about Sarah, a new mother who is struggling with the challenges of the postpartum period. Exhausted and overwhelmed, she feels isolated despite her partner's support. Her pre-existing anxiety has worsened, and she started relying on alcohol to cope with the intense emotions and stress. This reliance is becoming more frequent and concerning, raising a red flag for potential substance use disorder. Sarah's story highlights the common struggle of new parents and how they can sometimes lead to unhealthy coping mechanisms like substance use. Again, substance use is complicated and other elements may also be relevant. For instance, genetic predisposition. Addiction could have a genetic component. Some women can be more at risk. Several risk factors contribute to substance use during motherhood, including mental health issues, socioeconomic challenges, and a history of substance use. Understanding these factors can help in creating effective support systems. Britt, in Substance Use Disorders and Maternal Mental Health 2025, stated more than 30% of pregnant women in substance use treatments screened positive for moderate to severe depression, and over 40% reported symptoms of postpartum depression. Untreated maternal mental and substance use disorders are linked to high-risk pregnancies, poor infant outcomes, and maternal mortality. Adverse outcomes of untreated substance use include low birth weight, preterm birth, neonatal abstinence syndrome, impaired mother-infant bonding, and developmental delays. Pregnant people with opioid use disorder frequently have co-occurring mental health disorders, including depression, post-traumatic stress disorder, and anxiety. According to the CDC, suicide and overdose are leading causes of maternal death within the first year postpartum. Tobacco use during pregnancy is linked to increased maternal depression and anxiety, creating a cycle where mental health struggles and nicotine addiction reinforce each other. Pregnant individuals with illicit drugs use disorder have higher rates of using substances as a coping mechanism for underlying mental health issues. Mothers with substance use issues face numerous challenges that can hinder their recovery and impact their parenting. These challenges can exacerbate vulnerabilities during the perinatal period. Substance use can lead to serious prenatal health complications. It is crucial to address these risks through comprehensive care. If a woman stops taking illegal drugs during her first trimester, she increases her chances of having a healthy baby. However, if a pregnant person has no access to comprehensive care or support, the pregnant person is at a greater risk of health complications. Furthermore, substances in the mother may cause growth defects, behavioral problems, hyperactivity, and learning problems for the child. Assessing prenatal care is the single most important thing a pregnant person can do, not only for health reasons, but also to prepare for any legal challenges that they may occur. Pregnant people who use drugs may face challenges during labor. For example, ensuring access to adequate pain relief during labor. The Open Society Foundation reported in their publication on rights for pregnant people who use drugs, an expectant mother stated, "I was never offered pain medications during any of my pregnancies. I even broke my arm while on buprenorphine, and the doctor assumed I was just drug seeking." Many mothers encounter barriers to seeking help, such as lack of access to resources, fear of losing custody, and feelings of shame. Understanding these barriers can improve outreach and support services. Illinois is embracing harm reduction strategies for pregnant and postpartum people who use drugs. Illinois' harm reduction approach to perinatal substance use is shifting away from punitive responses and towards supportive, evidence-based care for pregnant and postpartum people. The Postpartum Women Opioid Use Disorder Pilot Project, which is funded by Federal Opioid Crisis Grants Initiative, provides trauma-informed screenings and care coordination, family-based treatment and recovery supports, which include childcare, vocational and educational services, transportation assistance. They also provide peer recovery doulas, who are certified doulas in active recovery who guide parents through both childbirth and substance use recovery. Another initiative is the Illinois Harm Reduction Toolkit, created with the PCC Community Wellness Center and the Academy of Perinatal Harm Reduction. This toolkit offers guidance for family and providers and pregnant people, tips for safe substance use, respectful language, and trauma-informed care, resources by substance type, and legal rights and advocacy tools to help navigate healthcare and child welfare systems. The state is also working on legal reform advocacy to decriminalize substance use during pregnancy, to end mandatory reporting to child welfare for substance use, and to promote screenings and treatment over punishment, especially through screening through the SPURTS, which is the screening, brief intervention, and referral to treatment models. Why do these initiatives matter for community outreach? Well, it helps to reduce stigma and messaging by emphasizing support over judgment. It connects families to local harm reduction resources and advocates for trauma-informed, culturally competent care. Stigma surrounding substances use can lead to isolation and reluctance to seek help. Societal pressures and negative perceptions can contribute to a cycle of substance use and negative outcomes. Addressing the stigma is crucial for improving outcomes for both parents and their children. Stigma around substance use, especially during pregnancy and the postpartum period, is a significant barrier to seeking and receiving care. Among the population of people who use drugs, pregnant people face some of the most severe health and social consequences. Pregnant people who use substances are routinely subjected to dehumanizing stigma, insufficient access to evidence-based treatment, and ineffective punitive responses. Despite these inadequacies, pregnant people themselves are routinely blamed and demonized for their drug consumptions. Cycles of negative outcomes are discrimination in healthcare. This can include judgmental attitudes from healthcare providers, which can deter individuals from seeking treatment. Legal and societal consequences. There's always a fear of repercussion, including, from child protection services, which can lead to family separation. And this Fear often prevents individuals from seeking help. Racial disparities. Mostly affected people of color are Black and brown. Most of these parents and their newborns are more likely to be tested for substances and reported to Child Protection Services compared to their counterparts. Misunderstanding of substance use disorder. There is a common misconception that substance use equates to being an unfit parent or even a criminal. This misunderstanding can lead to punitive policies and practices. They harm rather than help. There's an impact on mental health. The stigma associated with substance use can exacerbate mental health issues such as anxiety, depression, making recovery even more challenging. For example, if you are labeled by healthcare providers late to care, after 20 weeks of pregnancy, you can face additional barriers when seeking quality health care and are more likely to be referred to the child welfare system. Supporting recovery during pregnancy involves providing comprehensive care that addresses both physical and mental health needs. Effective prenatal care is essential in promoting health outcomes for mothers and their babies. Integrating substance use treatment into prenatal care can significantly improve outcomes, like making sure the baby is full term and a healthy size. For pregnant people, there are some potential risks that a provider can help with if they are informed of the whole picture. Healthcare providers should screen for substance use and offer appropriate treatment options to expecting parents. Starting treatment like methadone or buprenorphine can help reduce many of the risks of illicit use while improving both maternal and infant outcomes. Ideally, building a relationship with your healthcare provider to make decisions is important. Harm reduction organizations believe seeking care and treatment should never be dangerous, but it can be. Substance use during pregnancy is very complicated, not only to navigate medically, but also legally. What can happen if you're open and honest with your provider about using substances? Well, it depends. The situations are widely different state by state. Many providers may and can test urine or other bodily fluids without asking or even informing the patient. Drug screens are not good evidence. The most common screen is a urine analysis, which doesn't detect psychoactive substances directly. These tests can sometimes be inaccurate. Moreover, it is not mandatory for healthcare providers to test pregnant people for drugs. However, many healthcare providers do, since they are poorly informed about the laws around mandatory reporting, or they are following the guidelines developed by their hospitals. This means there is a chance that this information will be shared with Child Protection Services. Pregnant people have a right to know what tests are being performed and have a right to decline a drug screen or treatment. Creating strong support networks for mothers in recovery is vital. Support groups, family involvement, and community resources can provide encouragement and reduce feelings of isolation. Strong support networks are essential for mothers, offering emotional stability, practical assistance, and a sense of belonging that counters isolation and stigma. Recovery is rarely a solo journey. especially for mothers who are balancing sobriety with parenting responsibilities. According to PsychReg, support networks act as an emotional anchor, helping individuals feel grounded during turbulent times. These networks, whether made up of family, friends, peers, or professionals, can significantly improve treatment retention and long-term recovery outcomes. Support groups also play a vital role in recovery, providing safe, judgment-free spaces where mothers can share their experiences, fears, and triumphs. These groups foster empathy, mutual understanding, and allow participants to feel seen and validated. Mothers Against Addiction emphasize that peer-led and therapist-led groups help mothers build resilience, reduce shame, and develop coping strategies tailored to their unique challenges. Family involvement enhances recovery by reinforcing motivation and creating a stable foundation for healing. Supportive family members can participate in therapy, offering childcare, and help maintain a sober environment. Research from Samba Recovery shows that mothers with engaged families experience lower stress levels and improve quality of life during recovery. Open communication and shared responsibility fosters trust and accountability, while family therapy can help repair strained relationships and promote emotional healing. Community resources are critical for helping mothers navigate their recovery. These include employment services, childcare transportation, and specialized treatment programs. The postpartum period is the time after childbirth, typically lasting 6 to 8 weeks. It's a time of significant physical and emotional changes as the body recovers and new parents adjust to caring for a newborn. Postpartum recovery is a crucial phase for pregnant people as they adjust to parenthood while managing substance use. Implementing effective strategies can lead to better outcomes for both pregnant persons and their children. Postpartum SUD is characterized by the continued use of dependence on drugs or alcohol during and after the pregnancy period. Understanding this condition is crucial for effective intervention and support. Postpartum depression and anxiety are common among pregnant people. Particularly those with a history of substance use. Early identification and treatment are essential for promoting maternal well-being. Some common risk factors, again, are a history of substance use. Studies show that relapse rates for pregnant people with SUD can be 80% in the first year after giving birth. Mental health issues. Research indicated that women with postpartum are 2 to 4 times more likely to develop SUD compared to those without depression. Inadequate social support. And some additional variables are, again, trauma, a genetic predisposition, and again, substance use disorder can be caused in part by socioeconomic elements, including poverty, lack of access to healthcare, and demanding life events. Remember that pregnant people who use drugs and these factors are not their destinies. They are rather just risk factors. Not everyone with these elements will go through a substance use disorder. Any woman can be affected by substance use, independent of upbringing or situation. The effects of postpartum SUD extend beyond the mother. Ongoing treatment for substance use is critical during the postpartum period. Pregnant people should have access to resources that support their recovery while managing the demands of new motherhood. Effective treatment and recovery strategies for postpartum are essential for long-term success. Medical interventions may include medicated assisted treatment, while therapeutic strategies involve counseling and behavioral therapies, both aimed at supporting recovery. The National Harm Reduction Coalition and the Academy of Perinatal Harm Reduction offer credible support avenues for further assistance. These strategies aim to reduce the risks associated with substance use while supporting parenting responsibilities. They have, like you can see, they can track their usage, set boundaries, weigh the risk and benefits. They can avoid using alone. They can also choose safer methods, and they can limit the quality and quantity. They can plan for, they can have a safety plan and a parenting plan, and they can seek support. And of course, self-care. Ensuring a healthy start for children of mothers with substance use issues requires early intervention and supportive practices. Developing a strong bond with their child is essential for mothers in recovery. Strategies that promote positive interactions and responsive caregiving can enhance the mother-child relationship, establishing a strong and positive bond between mothers and their babies. It's incredibly important for both their well-being and the development of the child and the mother. It's crucial because it buffers the impact of prenatal drug exposure, promotes healthy development, and fosters maternal recovery. Implementing supportive parenting practices can make a difference in the lives of children. Parenting education and skill building can enhance effectiveness and promote child well-being. Access to childcare and community resources can significantly aid mothers in recovery. These services can provide crucial support and enable mothers to focus on their health and navigate the challenges of pregnancy and the postpartum period. It is essential for communities to continue expanding and improving these resources to ensure that every mother and child has the opportunity to thrive. Educational programs and outreach initiatives in DuPage County, Illinois, play a key role in addressing the issues of substance use disorder and mental health during pregnancy. By providing comprehensive education, support, and resources, these programs aim to reduce the incidence and improve maternal and infant health outcomes. Continued collaboration to invest in these initiatives are essential for creating a safer and healthier community for all residents. Understanding the challenges of substance use during motherhood is essential for providing effective support. By addressing these issues through comprehensive care and community resources, we can help mothers achieve recovery and ensure a healthy start for their children. And thank you, everyone, for joining me today. And I appreciate your time. Excuse me for the mistakes. I was a little nervous. I get a little anxious. But again, I appreciate your patience.
Okay, sorry about the mute tag there. Thanks, Annette, for the presentation. We appreciate it. A lot of great information in there. If anybody has any questions or comments, you can raise your digital hand if you'd like. There was a few things I wanted to point out that stuck out to me, which stuff I didn't know. Regarding criminalization of mothers who, show up for services, and because it's at a certain time in their pregnancy and they're still in active use, criminalization of that is ridiculous, and of course it affects populations that are already having disparity of services, and that could be extremely problematic. But the other one that is something I've thought of that's like, I guess, parallel to pregnancy, which is more of like a, um, somebody who maybe has struggled with substance use challenges, specifically opioids, who do have to present to ERs, who do have to present to hospitals for surgeries, for deliveries, things like that, that require pain medication. If somebody is previously, in recovery or might be predisposed to opioids, finding that solution, especially for the pregnancy too. So I think about that too, just as far as like, down the line. I'm very open. I've got lived experience. I'm somebody in recovery from opioid use challenges. So that type of thing is always in the back of my mind, which is, God forbid I have some type of like crazy accident, and then have to go to the hospital. I think everybody kind of thinks that occasionally in recovery. But there was a lot of really good barriers to discuss in that too. Again, barriers sometimes we don't think of. I was thinking about housing too. When we look at recovery housing, um, and we like bang the drum for more recovery housing and DuPage in general. But, to find recovery housing for somebody, especially parents of mothers of newborns, finding recovery housing for them can be really difficult. I know Oxford House does houses for children and women, and I think even men and children, which is great. But it just kind of goes to show, like, as you went through all those barriers, it's like there's these things we don't even think of sometimes just because we either don't have experience with it, haven't experienced it ourselves. So yeah, there's a lot of really, really good information. Did anybody else have any questions or comments or anything? It looks like Ben, you got your hand up.
Good morning, everybody. Thank you, Annette, for your presentation today. There was something that you spoke of that I was not familiar with, and that is something, I think I got it right here, neonatal abstinence syndrome. I don't really understand what that is.
Neonatal abstinence syndrome is when the child is weaning off of the substances. Oh, I can't.
So that's the child? Okay.
Yes, the baby.
Okay, I got you. All right. Thank you.
You're welcome, Ben.
Alicia?
Good morning, everyone. I helped a pregnant woman navigate. She had a opiate use disorder and was concerned about her baby and the stigma of the way she was treated. I could see it being a barrier for any woman wanting to go through that. She, it did sound the alarms, and she was in the system, and she's already full of shame and guilt on her own. And you said like the Illinois Harm Reduction Coalition is working on that, but in DuPage County, is there some place where we can refer someone to, is there a support group or a place where we know they're trauma informed and actually helping? Because I didn't know what route to go to. And it was really hard. My heart broke for her.
Actually, that's one of the reasons why I did this presentation, because I myself was looking to see what kind of services we can provide like that, and they were very far and few. And if you do look, if you try to find information on it, I feel like there is, but you would have to kind of navigate it like by going there. It's kind of hush hush, it's still kind of like stigmatized too. So yeah, I'm with you, Felicia.
May I say something? Hi, everybody. This is Matilda Faria from Haas. I know you can see me because it's only my front, but I'm ugly today, so I don't want to show myself. I just wanted to add that this is, even though I was late, Anna, you are such a great thing. I don't know, you are more than human. These people from now, oh my God, then I forgot the name of your organization, for God's sake, from ROSC. Have the best luck in the world to have you there. My God. Congratulations. That's it. Thank you, everybody.
Thank you, Matil.
All right. Any other questions? All right. Well, you want to turn that down, Annette? I just wanted to thank Annette again for her presentation, and I did hit record on this, so we didn't lose it. We're going to post that on the Facebook probably later today. And feel free to share if anybody wants the slides. There's a lot of good information. If, like us, this is an area that you might want to grow into, and the services or advocacy you provide, we're happy to provide those slides and that information for you. So yeah, thank you everybody. Next month we're gonna take our annual summer break off of the presentation series to kind of prepare for overdose awareness and recovery month, and we'll be back in September with another presentation. So yeah, thanks everybody. If you have any questions, feel free to reach out, and if you'd like the slides, we can share that. And any last words you want to say before we sign off?
Again, as we were discussing today, this is a very important topic, and I would hope that we can collaborate in any way possible so that we can start making more awareness on people who are pregnant, people who are using drugs, and advocating for more meetings and housing and just support services for them.
All right, thanks again, everybody. We appreciate you, and we will see you at the next one. Everybody have a great rest of your July. Bye.